I get the honor of coming to you today to talk about autism in the news, a pediatrician's perspective. And so it's gonna be a topic, and I think that we'll have a good opportunity to really do a fairly large brushstroke over all of the different things that have been in the news in recent memory as it relates to autism. And so my job is going to be to help explore these developments and trending topics as it relates to autism in the news. We're going to talk about some of the things that we know and the things that we don't know as it relates to the news items that we are often hearing. And then the goal here is to really help all of us to anchor in evidence-informed best practices, help us to think about how do we discern what the news is telling us compared to what may or may not be clear in the data. And so certainly for the next 45 minutes, I'm going to be talking to you about autism in the news, a pediatrician's perspective. So excited about that and certainly open to answering all of your questions. So let me share my screen with all of you and then we'll get started. All right. Okay, so I have to admit that as putting this together, I was starting to just really overthink things. So we'll see how well I overthought it. And so it tends to be one of my strong suits is overthinking, but hopefully this will be helpful to all of you because I know that I, for one, have seen so many things in the headlines about autism and often have questions asked of me by both parents, people on the spectrum, my colleagues, like, what does that mean? What am I supposed to do with that information? And so hopefully we'll be able to kind of dig deeper into some of these headlines and understand them a little bit better. I talked about this already, but our objectives are really to identify those recent developments and trending topics and discuss some evidence-based perspectives. I am going to be coming at this as myself, as a pediatrician, and so that's my perspective on these things. I will obviously try to expand that lens to be inclusive of all of you, depending on what walk of life you are coming at this perspective from. And there may be some controversy in some of the things that I'm going to be saying. And so certainly I welcome those that have different opinions and different perspectives on that. And so again, like I said at the very beginning of the day, in case you weren't here, we like learning from people. And so we want to have questions asked that we can noodle on, so to speak. And so we definitely want to have those opportunities to do that. But we always do that with respect and collegiality, or that opportunity to engage in those tough conversations as it relates to our profession, but obviously with always thinking about being kind as we go through this as well. All right, so let's dig in. We've got some important things to talk about. So certainly we know that autism has been in the news a lot. And so whether that is on the cover of magazines, Time magazine had a whole special edition about autism, which by the way is awesome. And shout out to Echo Autism. It is highlighted in there, so we're pretty proud of that. But also the special edition of Very Well also did a really nice job of covering lots of different things about autism. The other thing that I would say is even though I'm going to be focusing on kind of the traditional media approach to autism in the news, I can tell you as somebody who's also on most of the social media channels, these are hot topics. And so lots and lots of people are engaged, maybe not in the most civil of discourses at times, with each other about some of these topics that are facing the autism community. And so certainly I want to be clear that I'm not planning to cover everything and anything that's out there. I'm going to talk about a couple of key things that have been in the news of late and how we can better understand maybe some of the subtext, not the like political subtext, but some of those deeper facts that go behind the headlines. And we'll talk more about that too. But I certainly think that that's helpful. I'm going to anchor us first, though, in this concept about thriving across the autism spectrum. So again, I think today has been a great example of how broad the spectrum is, how many diverse opinions and perspectives and experiences there are across the autism spectrum. And I think that our goal, if I could be so bold, is to suggest that thriving across the autism spectrum, across the ages, across the support needs is a goal. I think that's something that all of us need to be really thinking about. You know, when I think through how I practice, when I think through how I teach, when I think through how I'm a friend to people on the spectrum, I want to be in a place where I can support them to thrive, whatever that looks like. And so that's going to anchor us today because we're going to be thinking about what do these flashy headlines mean? What do we do? How do we think about them? And certainly, I think that those are important topics. And I want to, again, you're going to see this picture a couple of different times, but it's going to anchor us in that reminder that it's not about, causes and cures and fixes and all the things, right? It's about thinking through how does this anchor us in thriving and people who are autistic thriving across that spectrum. Similarly, going to anchor us a little bit in kind of that definition. So I've seen some great questions come in today that we haven't had a chance to necessarily address, but everything from, what do we think about self-diagnosis to what do we think about different aspects of the spectrum? And so here we're going to talk and kind of just define what we're talking about when we think about the spectrum. So the spectrum there, it's a set of characteristics, so otherwise known as symptoms, if we're talking about things with our professional medical hats on, but a spectrum of characteristics that can definitely vary in intensity and complexity across settings, across time, and with and without support. So certainly all of us could say that about ourselves, but autism specifically is important. I also absolutely love this image from Autism Sketches, who is an autistic sketch artist. I use it a lot because I think she does an incredible job of representing important aspects of this spectrum. And I think why I wanted to highlight this for you is because often when we're seeing headlines, we're seeing nods to kind of misinformation. And I don't mean that in a political way. I mean that in that stereotyped way. So when we heard Andrew and Luis and Charlotte talking to us about the things that they wish, stereotypes they wish would go away, I think that was really not only incredibly insightful of them to help us see what their perspectives were on that, but I think what we'll often see in these bold headlines is, again, a hearkening back to things that probably aren't as up to date as they may need to be. One of which is this idea that autism is a linear thing where it's all or nothing, or that person can't have autism because they look like this, or this person, can't have a meaningful life because they are, not able to do these things, right? We know, and we've debunked a lot of that today, but certainly it reminds us that it's much more of a pizza pie, if you will, as we think about our autistic loved ones, friends, colleagues. I think all of us, if we took a look at our lives and thought about what our skill sets are, we'd probably also have a pizza where we might have a couple of slices that are fully, we're doing great in certain areas, and then other areas where you're like, ooh, I need a lot of help. And as I lovingly often reference my husband at this point, he knows that I need a lot of help, right? Like he's frequently having to bring stuff to me. Had to do it recently at the airport. I forgot my charger for my computer and I'm going on a business trip. Can't make it very far without that. So does he argue about bringing me my charger? No, he's amazing. And so he brings me that charger, right? But you could argue that do I have, am I having a significant struggle in the department of memory and executive functioning? Maybe, right? But then I have other aspects of what I do and how I do it that are, excelling. And I think autism is the exact same way. And Ramiro really helped us to think about that and challenging that concept of normality. One of these days I'll say it without stumbling over that. But certainly when we think about this, we've got to keep remembering that even though autism is currently a diagnosis, many of us could say the same things about ourselves. We all have sensory experiences. We all have different needs and support needs. And so how do we think about that? And again, I'm anchoring us in this as we start to dig into some of these headlines. The other thing that I think is important, and I really, frankly, we could do like an entire day on the state of research and learning that is going on in autism. But I think the take home message is that, frankly, we are constantly learning about autism, about autistic people's experiences, about all of the different aspects. I mean, we even just heard an entirely different aspect of autism that many of you, by the questions, have lots of questions about. So we are constantly learning, not just about the breadth of the autism spectrum, but then the depth, right? So those deep, deep questions about what part of the brain is most characteristic of an autistic person, what genes are going on, but then also that breadth of understanding what services are helpful and for whom and when and how, and all of those different questions. So certainly lots and lots of learning is going on, but also needs to continue happening. So these are some kind of truths, if you will, that we're going to kind of use as some anchor points as we start to dig into the headlines, because there's a lot. There's a lot going on. And like I said, as I prepared for this, I was thinking to myself, man, autism has been in the news a lot. Sometimes I think it's just because it's like the only thing I think about. Just kidding. There are other things I think about. But generally speaking, though, this is a lot of what I think about and talk about all the time. And so when I started looking at headlines, even just from the last few months, I think it'll be a little bit potentially surprising to you at how many headlines there have been. All right, so the first one we're going to look at is the CDC numbers that came out, and they come out about every 2 years. And so we're just talking today about that number, 1 in 31 autistic people in the United States are autistic. Now, I'm not actually going to go into the way that this data is gathered, because that actually could be a whole other talk in and of itself too. But it's a really interesting way of gathering that data. And it's safe to say that we have not literally counted every human in the country and then figured out that out of every human in the country, 31 people, or 1 out of every 31 is on the autism spectrum. So that's important to understand, that that is a research design method that allows us to then generalize or extrapolate what the prevalence of autism is across the United States. So that number bears an important history lesson. So we're going to talk a little bit about the history, because again, when you don't know kind of the history of something, you may not have any idea what to do with a number like 1 in 31, or when someone says to you, oh my gosh, autism is an epidemic, certainly something is going on, right? Okay, and again, I'm not here to debate that particular statement, but when we think about autism, it's important to understand the history. So what we know is that really in the early 1940s, that was the first time that autism was characterized as something separate from schizophrenia. You've heard a couple of our other speakers today talking about that as well, but essentially that's when Hans Asperger, Leo Kanner, and a couple of others kind of in those early 1900s really started to describe this set of characteristics that they coined autism. Then in the 1980s, which as a lover of 80s things, I don't feel like was that long ago, but that was the first time that autism was included in the DSM. So that was the DSM-3. But think about that for a second, right? So that means this is not a centuries old diagnosis. Now, that doesn't mean that people on the spectrum haven't been around since the dawn of time. We know that that is likely very true, just like diversity in our experience as a human. This is not new. It's not that autistic people were first created in the 1940s, but that's when scientists and researchers started to first describe it. And that it entered into our books in the 1980s. So imagine what we've had to understand about autism, as well as all the other things in that short period of time. So then in the 1990s, when we were using the DSM-4, that's when we had multiple different kind of buckets of autism, if you will. So that's when we had autistic disorder, pervasive developmental disorder, not otherwise specified, Asperger's syndrome. And certainly the categories were broad in that we had different categories, but it was still not quite cutting it in the description of what we were seeing as clinicians. A extensive amount of learning and rapid discovery happened in the 1990s into the mid 2000s in better understanding what are the characteristics of autism separate from intellectual disability, separate from other types of issues like ADHD or others. And then not just separate from, but then what happens when you have both? What does it look like when you have autism and intellectual disability, or autism plus ADHD, anxiety, etc.? And so certainly we learned so much, which is what led to the DSM-5 in 2013, and that collapse of the autism categories into one umbrella category that we now refer to as the autism spectrum. Okay. So now here's where that was this little short history detour, but now we're going to talk about those prevalence numbers again, because this is usually what people talk about. I know that it's not uncommon if I'm traveling, usually when somebody finds out what I do, their first question, especially if they're, somebody who doesn't know a whole lot about autism, is what's going on with the numbers, right? And so that's always a fun airplane ride or dinner conversation. I've had it many, many times. But when we look at these numbers, that's a logical question to ask. What's going on, right? Like, so in 1970, you're telling me that it was, 1 in 5,000, and today you're telling me it's 1 in 31. What's going on with that? Okay. Now, we are not here to have an entire talk on these numbers and all of the things behind the etiology and autism, but I do want to contextualize these numbers a little bit for you by showing you some contemporary issues that have also been going hand in hand at the same time. So, for example, in 1975, we had our very first federal legislation that supported the rights of children with disabilities in the education space. At the time, it was called Education for Handicapped Children, and that was the first time we had any kind of educational rights for kids with disabilities. Then in 1990, that bill was kind of reissued, so to speak, under the new name Individuals with Disabilities Act, and it replaced the EHA. Again, establishing rights and reestablishing rights, educational rights for kids birth to age 21. And importantly, autism was added as an eligibility criteria or an eligibility category. So that means that prior to 1990, if you needed, for example, an IEP, autism was not something that was going to be an eligibility criteria or category that you could have services under. You would have to have other issues going on, like a learning disability or like um, uh, intellectual disability and things like that. And so certainly thinking about that, 1990 is the first time that we were able to have autism as a standalone category for educational supports and services. So what else was going on in this time frame that we're looking at with these numbers? So in 2006, the American Academy of Pediatrics, the folks that kind of help us pediatricians know the things that we're supposed to do in the care and well-being of children, says, hey, we need all of the pediatricians, family physicians, nurse practitioners, anybody doing well-child checkups, so those kind of checkups that we do, we want you to be screening for autism at all 18 and 24-month well-child checks. That didn't happen before 2006. And so you can imagine you now start having, 100,000 pediatricians, for example, start to do universal autism screenings. You're obviously going to be picking up more kids. Now, where did that come from? There's a lot of data behind that recommendation. There's a lot of understanding of the power of early neural development and helping to understand like, hey, when we identify unexpected development early, we have an opportunity to support that child in gaining skills that are necessary to be successful, for example, in school or in their home or things like that. So nevertheless, this is a contemporary issue that was going on at that same time. Another fun fact for you is that in 2007, this was the year that the first state passed insurance mandates for ABA coverage. Prior to that, families either paid out of pocket for ABA, so applied behavioral analysis, or schools at some places were covering ABA, but no insurance companies were required or were covering ABA therapy prior to 2007. Incredible advocacy happened from what you'll see here in a minute, from starting in 2007 to say, hey, no, this is a medical necessity for people who have autism spectrum disorder. So we've talked a little bit about the DSM-5, but we also know that expansion, it's not really an expansion, but that clarity of understanding who can be characterized as being on the autism spectrum changed in 2013. And so we had a different understanding of all of the different kind of components that a person could exhibit autism characteristics. And so certainly that was a change as well. 2019, the 50th state passes insurance mandates for ABA coverage. Think about that, right? So think about that. Prior to 2007, no insurance coverage for ABA therapy. Families were paying out of pocket or, doing all sorts of things to make sure that they could afford that particular type of intervention. And then all of a sudden we have this huge change in access. So, okay, we've got these contemporary factors that are going hand in hand with those numbers. Oh, I did want to make one more comment before I move on from this. Just to highlight for you all, in 2000 is when we first started looking, the CDC started looking at their epidemiologic data. So that's why those bar graphs are blue, because that helps us to understand that that's all collected in the same way. The green are numbers, but they were not collected in the same way. And so that's an important thing to understand as well. Because when you're looking at this data and you're seeing that headline of 1 in 31 kids in the United States are diagnosed as on the autism spectrum, that's just an important thing to understand, especially when you hear things like, when I was a young child, nobody had autism, right? Or whatever has been said related to autism prevalence rates in the 60s and 70s. And so certainly things just to understand as you look at this information and as you hear those headlines. So this is just a recap slide of this particular headline, but what we know is that there's a broader diagnostic kind of criteria. Things have expanded, our understanding has increased, and when we think about our ongoing understanding of autism, it continues. And I suspect the DSM-6 is going to look quite a bit different. I don't know. I don't have any insider knowledge of that, but I do think that there's going to be opportunity for us to continue to refine that criteria. And that may have implications on those numbers that you see in the headlines. We also know that incredibly passionate people, parents, clinicians, advocacy organizations have raised awareness, which has led to more acceptance and reduced stigma associated with the autism diagnosis. And so that's, I think, also important for us to consider. We also know there's been a ton of effort into earlier identification of kids who have unexpected development. So, for example, when we've got toddlers under the age of 2 who are demonstrating unexpected behaviors, so differences in their social communication, they are being identified under age 2. And so that's a good thing. And yet, it's also influencing some of the numbers that we see. Talked about school-based eligibility, insurance mandates for medically necessary autism services, and then, which I'll talk a little bit about here in a few more minutes, is this rise of the autism service industry. So as we think about now, we've got schools who have a meaningful way to provide services to autistic people in their classrooms or in their school buildings. And now we also have avenues for coverage related to autism services, specifically ABA in this context. So what does that mean, right? And so as we think about these headlines, as a pediatrician, these are the things that I'm considering. And I'm thinking to myself, like, okay, so when people say, well, could it be environmental? Could it be this? Could it be that? Certainly, I'm not going to say that we have 100% clear understanding of all of those questions, but I do think that we have to at least inform ourselves about what other issues are going on in this same space as we look at that headline. Okay, so now let's talk about the other headlines. And again, we're going to cover about 5 different headlines, not just from this particular press conference, but I think that this is an important one that we do want to dig into a little bit more. So obviously, I think it's a great thing that we have federal attention on autism, okay? That is an important thing. When we talk about how do we elevate autistic people's thriving, we have to have people talking about it. We have to have people understanding the needs of autistic people and their families. We can't just kind of hide in a corner and hope people pay attention to us. And so certainly, whatever opinions you may have about the political climate that we're in or the things that are going on, I'm going to tell you that I'm happy that there's attention focused on autism. Now, we're going to dig deeper, though, into some of the headlines that came out of this particular press conference and talk through what was said. So what exactly happened, maybe not what was said, but like what happened from them, and then also kind of break down the various components of the information that was shared. Okay, so first we're going to talk about Tylenol or acetaminophen. In case any of you need to practice saying that, it's acetaminophen. And by the way, paracetamol is the name of it in any other country outside of the United States. So, what were the actions that actually happened as a result of the federal initiatives that took place in the fall of 2025? Important to understand this, and this is really nuanced, so you don't need to take a test on this later. But certainly I want people to be understanding that there's a lot of detail. And so when you hear the headlines of the FDA says XYZ, you might want to look at the details, right? So here's what really happened. The FDA initiated a label update that was related to association between acetaminophen or Tylenol use in pregnancy and the subsequent development of autism or ADHD in children, okay? So it initiated that. The FDA also acknowledged that acetaminophen is the only over-the-counter medicine approved to treat fevers during pregnancy. And then also, they acknowledged that high fevers in pregnant women or pregnancy can certainly pose a risk to unborn babies. Okay, so acknowledgement there. They also announced guidance to use the lowest effective dose for the shortest amount of time in individuals to essentially accomplish what's necessary to reduce fever, et cetera. Okay, and then to certainly consult with your healthcare clinician as you're trying to make these decisions. So this is actually the federal items that came out of that particular headline. Now, I think you can all recognize that there are a lot of headlines that came out of that particular press conference. including many, many social media memes that either you can think are funny or can think not that are not funny. But I can tell you that there's real world impact from the headlines that came out of that particular event. So here's one of the issues, right? Many people will interpret headlines in different ways. And unfortunately, this is where we as professionals and advocates and autistic people have to be more informed than the average person, because we've got to be able to understand what exactly is that headline talking to us about. So some people may have interpreted those headlines to mean, oh, did you hear? Autism is caused by Tylenol, right? They also may have heard, whoa, common medication, hidden risk. I can't trust any of this stuff. Oh my gosh, right? Also, some people may have heard, I just better not use it, right? Like I know I have a fever, I know I really hurt or this or that, but I can't trust anything because, whatever I just heard makes me think that Tylenol may be detrimental to my child. And then I think importantly, people may have heard or interpreted from those headlines that maternal decisions cause autism. For a long time, for decades, we have had different perspectives. People saying, it's moms who have reduced empathy for their child, the refrigerator theory, things like that, that contribute to the development of autism. We've debunked those things, and yet here we are having conversations that talk about not only talking about parents and real medical issues, but then also referring to autistic kids as something that like I can't take Tylenol because that's going to result in autism. And I think that's something we've really got to grapple with. And we've heard today from a lot of different people, and I'll reference the Listen to the Spectrum panel, in that autism is not something that is devastating. Now, I agree that there are certain situations, especially like we just heard from Dr. Smith, that you can have really intense, really prolonged, lifelong high support needs that are very, very intense. But I would make the argument that that person's life, that autistic person's life, no matter where their support needs fall, is valuable. And I think it's certainly something we need to understand. And so when we say things like, better not use Tylenol, it might cause autism. What are we saying, right? What are we saying? And so I think that's an important thing for us to understand. So what are the real world consequences of things like these types of headlines? Well, for starters, just the facts. So we have more untreated fevers in pregnant women, and then more increased visits for, I don't know what I should do. What else can I do? Sadly, people started substituting other kinds of medicines that actually do have more risk associated with them, not for neurodevelopmental disabilities, but for other things like kidney issues and things like that. And so certainly that's not helpful, right? But they're hearing this headline and they're thinking, oh my gosh, I need to do something so that autism, right? Well, wow, we've come a long way in trying to understand and be more inclusive of the autistic perspective in our society. And so what are we hearing here? And how do we understand how that comes around and how we think about it? One thing that we also know about the human mind is that we like to make things simple, believe it or not. And so sometimes when people hear these like simple solutions to a complex issue, they like to latch on to that. And so this single cause thinking kind of had a resurgence after some of these headlines because it's like, oh, great, problem solved. We now know what it is and we don't have to think about it anymore. Well, unfortunately, autism doesn't work like that because it's the human brain, right? And so certainly we don't want to eliminate the diversity that we experience in our human brains. And yet there are aspects of autism and the science that we are all a part of or that we're trying to be a part of that are important. But when we talk about these things, this is where it's important for us to understand what exactly is that headline saying and how would I know? It eroded trust in routine pediatric guidance, right? So as a pediatrician, I know that really the only medicine that is known to be or to not cause problems when it comes to fever reduction is Tylenol in that first 6 months of life. And so certainly that's well studied, but that started to become a debate among parents who were understandably confused, understandably questioning, like, what am I supposed to take from this? And then I've already said this, but this paradigm shift of like, oh, well, maybe it is the mom, right? Maybe she decided to do something and that's why their child has unexpected development, right? We know that's not true. And yet sometimes when we have these headlines, that's what we hear. Next topic coming out of that event in September 2025 is leucovorin. So I'm going to spend a little bit more time here because I know there are quite a few clinicians on the program today. But first and foremost, we're going to talk about what happened, which I think is an important thing to understand because again, that headline did not match up with what the actual federal actions were, and so that's an important thing to understand. We also know that, frankly, when you talk about headlines, when you talk about news and you talk about people, trying to get people to pay attention to the news, it makes sense that they're going to have kind of, flashy headlines that are like, woo, look at this, right? That's the point of the news. That's the point of trying to grab your headlines and make you read it and that kind of stuff. And so I am not saying that what took place during the actual events themselves were dis, you know, convoluted, if you will. But I am saying that these are the actual administrative actions that happened as a result or as a part of that press conference. So the Food and Drug Administration in September requested to fast track a new indication for leucovorin for specifically, and this is a mouthful, but FOLR1 related cerebral folate deficiency. Very specific request to fast track, okay? In March, so just literally like a couple weeks ago, the FDA approved a new indication for cerebral folate deficiency and explicitly did not add any indication for autism. That's really important because the headline was like new drug for autism, right? That's just not what happened. And so even I fell prey to that particular headline because I thought, oh, okay, right now the FDA is approving leucovorin. That's just not what happened. And so I think that's important. Simultaneously, though, at that same time, what we had was the Center for Medicare and Medicaid signaled, meaning kind of like said, hey, we're over here, we're paying attention, an intent to request state Medicaid programs approve coverage for leucovorin when, key piece here, when the FDA indication was approved. Okay, so not automatic, not okay, cool, now Medicare or Medicaid in most of these situations is going to cover this. But when this is approved, then we will start our process for requesting that state Medicaid agencies cover this particular supplement or prescription. Also, what did not happen was that there was never a national coverage mandate that was released as part of all of this, which again, kind of the headlines alluded to the fact that there was, and that's an important thing to understand. I'm hoping I'm not losing you, but I think it's important to understand when people are out there spouting off different things or when you're reading about it after the fact, because most people probably didn't watch it. But when you're thinking about those headlines, there might be more to it. And so, how do you know and where do you go from here? Okay, so what did some people hear or what did they interpret from those headlines? I gotta tell you, lots and lots and lots and lots of physicians, hook, line, and sinker, were like, this is what I heard, this is my take home message, and this is what I heard. Leucovorin is now approved and covered as an autism treatment, right? No, right? So that's not what happened. But yet, that is often what people were left thinking after the headlines. Many people also interpreted that now this is government endorsed, it's been fast tracked, therefore it's proven, data must be there, FDA doesn't approve things unless it's proven, things like that. And so certainly breakthrough or that coverage is certainly something that we have to think about as well. And so we assumed coverage was available for this new therapy when in reality there were many, many, many steps along the process that were had not taken place yet. Real world impact is that it significantly increased the volume of leucovorin prescriptions. It did lead in some areas of our country to a shortage for the primary use. Leucovorin is typically used as an adjunct or an added therapy for methotrexate. And so certainly the shortage for people who rely on leucovorin to protect their healthy cells when they're going through chemotherapy, not ideal, right? And that's a real world impact. Clinicians, though, were also doing their best to support families who had questions, well-meaning questions. I can tell you social media is very, very, very busy talking about leucovorin and all of the different things as it relates to trying it and it works and all sorts of stuff. And so clinicians then were trying to figure out, what do I do? I want to support my families. I want to prescribe this, but I want to do it with due diligence. And there's no information about safety, dosing, or outcome expectations because the studies haven't been fully completed yet. The process with which we go through FDA approval for new medications for new indications hasn't been done yet. And so some has, but we haven't gotten all the way through that process. So certainly it's important for us to understand those elements of this as well. So very quickly, and I want to reference the AAP interim guidance on leucovorins use in autism, as well as the accompanying FAQ. Lots more detail there. If you just Google AAP interim guidance leucovorin, it'll come right up. The FAQ, though, goes through all the things that if you're a prescribing clinician, you probably are wondering about. Should I test for something first? Should I do this at all? If I want to do it, how do I do it? What is it? All of those different things. And so I'm not going to spend a lot of time on this today because I do think that that resource is a really, really good one that actually gets updated every single time something new comes out. So like the March update related to the indication for cerebral folate deficiency, we've already updated the interim guidance as it relates to that as well. I think the take-home message here is that many professional organizations said, nope, we do not recommend it in autism. The AAP was a little bit more nuanced in that they said there is insufficient evidence, though there is evidence, but it's insufficient to recommend that every person on the autism spectrum should give it a go. I think the important take-home message here is that we don't treat autistic people differently than anyone else. I wouldn't want somebody to say to me, oh, we just don't know what to do with your son or daughter, and we don't have a lot of options, so we're just gonna try this, right? That is not how we treat people. That's not how we engage in dignified and appropriate prescribing or supporting of people. However, we do want to make sure that our clinicians are equipped to be able to have shared decision making. Now, when I talk about shared decision making, which also is a talk in and of itself, that's essentially you as a professional understanding what is it, what do we know, what do we know about it, what do we not know about it, hearing what the family knows, what the family would like to understand about it, talking it through, and then agreeing on what you're going to do next, and really having that informed conversation about risks and benefits, about thinking through how are we going to know if this is helpful. Certainly lots and lots of deep information to be thinking about there, but I would encourage you, if you're a clinician and you're thinking about or have already prescribed leucovorin, please make sure that you're doing it with eyes wide open. I think that's an important thing for all of us to consider. So we spend a lot of time when we talk about autism in these early stages of life, but we sometimes forget that there's more stages to the life that autistic people live. And so certainly we're going to spend the next couple of headlines talking a little bit more about that early space, but then we're going to transition into some later ages as well. So when we think about early diagnosis, everybody wants to talk about the wait times and getting in for an autism evaluation. And oh my goodness, I have a question about my son or daughter, and why does it take so long? So there have been headlines about different types of FDA devices that are approved to market, which is a distinction there. So that's what that means, is they're approved. They've been shown to not cause harm, so they can go out to market for use. Okay. So there are two FDA approved to market devices. One is called Early Point. The next is called Canvas DX, which is by a company called Cognoa. And there have been some studies that have looked at the use of these different devices in the aid of early diagnosis, including one that my own team and I have partnered to really figure out, like, is this something that could be a best practice in the hands of trained clinicians? So these are things to understand. But guess what? People often think about, oh, cool. All right, this sounds great. Maybe this will be my nirvana. I don't have to think about, 2 year wait lists or 1 year wait lists or all of these different things. It's not newsflash. It's not nirvana. Here's a little bit more about what these different devices entail. So essentially, the first is a software as medical device that helps to combine different aspects of the evaluation of a child. So some home video, some parent and clinician report, to essentially report out a device output. So the likelihood factor of a person being on the autism spectrum. We also then have Early Point, which is using eye tracking, the social visual attention patterns of a person, to better understand if this person's on the spectrum or not. And so certainly these are important things for us to just have a better understanding of what these devices are before you think like, oh, perfect, this is a great solution for my problem, if you will, problem of access to early diagnosis. So technology-enabled autism diagnosis is definitely kind of the headline. You'll hear about this in different ways. But essentially what some people are interpreting is, great, this device will decide if autism is the diagnosis. It's just not that simple. Diagnosing autism is not easy, even though that may be how some people interpret those headlines. And so what do we do with that? And how do we think through what the real world impacts are? So I can tell you that I have many families, anytime one of these new kind of headlines comes out, they think, great, I don't have to wait anymore. Can you just prescribe this for me and we'll be good? And I'm like, not so fast, right? So first of all, we have issues with insurance coverage of these devices. We have issues with understanding, okay, autism is not just about a device output, it's about your child. It's about individually thinking about your child and what supports and services might they need, again, to thrive, right? So those are important things for us to understand. So, what is in a diagnosis in the first place? And when we think about this, we think about connecting to supports and services. And I'm just going to give my team a heads up that I'm going to go a little long. For anyone who knows me, you'll know that that's not surprising. And so, when we think about the purpose of diagnosis, I'm going to walk us through into a new type of headline here in just a minute. But there's a lot being made about diagnosis, but then even more being made about how do we connect people to supports and services that matter to them. And again, that concept of autistic thriving. So this slide is really just meant to reference the concept of what is behind a diagnosis and like what do we think about the outputs being as we go forward. And this next piece is going to help us remember that the stages across the autism spectrum are broad. And so even though we spend a ton of time thinking about the little kids and diagnosis, then there's the whole aspect of what do we do after a diagnosis? And unfortunately, many headlines in just the last month or so have been focused on issues related to the expansion and kind of expenditures related to ABA. So these headlines, you may or may not have seen them, but certainly we know that there have been some pretty significant concerns about expenditures as they relate to autism in various states. Similarly, you may or may not know where some of this comes from. So, very smart and savvy and intuitive investors in private equity realized a couple years ago, like, hey, I see a potential opportunity here to make some significant profit. And they started to buy up ABA organizations and say, hey, I think we can help scale access to this evidence-based type of intervention. And that's exactly what they did. But unfortunately, the regulations and the controls around that scale really hadn't been built yet because ABA is a relatively new field. And so understanding that is important. So even though we're not going to take a deep dive into this particular headline, I do want to show you a couple of important things. Medicaid expenditures for ABA have increased by 298% in the last couple of years. That's huge. Part of that, again, is due in part to how things have changed so drastically over the course of our, last 6 to 7 years. Lots more big capital, lots more information. And in fact, this data looking at the Medicaid spending is really from, I think, a couple days ago. So this is really, really hot off the presses information. But you can see, like, it's logical that Medicaid is starting to say, like, we can't afford that. What are we going to do? And how are we going to do this in a meaningful way? Okay, so what are the consequences of those headlines? A lot of people are interpreting, oh, ABA, if you have autism, every single person on the autism spectrum should have ABA. That's a headline that is often misinterpreted. It's actually not true. The data does not tell us that every person on the autism spectrum should have or benefits from ABA therapy. So that's an important thing for us to understand and for us to think about. It also calls into question that people may interpret that autistic children aren't getting the therapy that they need when they hear about some of these fraud situations that have happened where no kids are getting therapy, but they are being billed, or Medicaid is being billed for that therapy. On the flip side, though, some people may interpret that autistic kids are getting a ton of therapy and it should be covered and they're getting what they need. Okay. All right. That's a valid opportunity for us to think about. It is absolutely, though, calling into question, and people are interpreting some of these headlines and asking themselves, well, what is the return on investment for these millions and millions of dollars that we are investing for ABA therapy for kids on the spectrum? This has real world impacts. I see this in clinic all the time. Families asking me, should I not engage in ABA therapy? Do I like it? As a pediatrician, do I recommend it? And here's what the thing that we know is that we don't have great answers for exactly who is going to benefit the most or in what ways to being participating in ABA therapy. This is not a talk about the pros and cons of ABA. This is just a talk about how we think about these headlines. But certainly, when we see companies saying if you can't do 40 whole hours a week of ABA therapy, then sorry, we can't serve you. That's a real world impact of these headlines. When you've got companies saying like we're going to prioritize the people who can commit to 40 hours a week, not 30 hours a week or not 20 hours a week, that leaves a pediatrician like me in kind of a hard spot trying to figure out what am I going to do, right? And frankly, I don't have anybody that I would recommend 40 hours a week for, so then what? And that is where some of the limitations also come in, is that we don't have good data around dose, how many hours of ABA are necessary for what kid. We also don't know how many months of ABA or how many years of ABA. And that's really, really, really challenging. So these headlines cause us to think and should cause you to think more critically about some of these topics and the issues that are coming up. So the last set of headlines that I'm going to talk through, and I think this is really, really important, is about safety. So what we know is that people on the spectrum are at a significantly higher risk of death due to a couple of different aspects. So this is literally just in the last month, all but one. It was just in the last month. Children dying from drowning, a young man being shot by law enforcement after he had called for help for a mental health crisis. These are real headlines. These are real families. These are real kids and adults that are experiencing really significant mortality in the face of these headlines. So looking closer at this, and a lot of this data comes from colleagues at the National Safety Initiative. And so thinking about the risks, we know that people on the spectrum are at a high risk of elopement, drowning, 160 times more likely to drown, to die by drowning than their non-autistic peers, injuries from other causes, suicidality, another really important one for us to understand, all huge impacts. And those headlines, even though we may, as autism, many of you are probably, consider yourself autism advocates or people who care a lot about people on the spectrum, you may see those headlines and think, oh no, that's really sad. The bottom line is that is really preventable. And there are things that we need to be doing differently for us to be able to look at those headlines and not just say, oh no, that's awful. What are we going to do about it? Right. And so that's where I want to challenge us to take action. And I've only got a handful of more slides, but I am going to finish them because I think they're important for us to understand. Headlines are fine. We can all fall kind of victim, so to speak, of reading a headline and believing it. I do. I bet many of you do as well. But I want you to learn how to critically evaluate those headlines. Doesn't mean the headline's wrong. It means there very likely is a whole lot more information below the water level of those headlines. So in this specific situation related to safety, we as professionals need to do a much better job, a much more reliable job about asking related questions related to safety. So screening for elopement risk, screening for suicidality, not just assuming that because they're autistic, they're not suicidal. That's just illogical. The data tells us a completely different story. We also need to encourage parents and loved ones and others that we need to always be thinking about safety. We know that times of transition are the highest risk for elopement. So what do we need to be doing? How do we need to prepare our communities, our families, our autistic kids with the skills necessary to stay safe? All of these things are really vital. We also need to commit to learning more. We've talked a lot about this today, but communication differences are often at the root of many of these safety issues. Unexpected behaviors also often at the root. So when someone doesn't respond to their name or they're given instructions to stop or don't move, and maybe they don't seem to be hearing them or hearing them in a different way, what does that tell us? And certainly taking action. We cannot just sit by and look at those headlines and say, oh, darn, right? We've got to be alert. We, as citizens of our world, have to be on the lookout for kids who might not be where they belong, right? And so thinking about that and understanding that, oh, shoot, that kiddo does look to be interacting differently. They might be on the spectrum and I don't see anybody near them. Maybe I should make sure that they're safe, right? We need to pay attention. We need to advocate for change. Those are all important things for us to think about. So briefly, I'm going to talk a little bit about real-world, real-time priorities. As a clinician, I'm not going to read all of these to you because I'll just put them up here so you can see them. I have endless clinical questions about my patients and about the world that I live in, and I'll just list off a few of them. So, what elements of an autism diagnostic evaluation are essential to inform services for an autistic toddler? Do I need an 8 hour evaluation in order to figure out what services they need? I don't know. Do I? Right? So, thinking about those things and how do we know? How do we know what is the right approach to the right kid at the right time to get exactly what they need or to get at least close to what they need? Similarly, what are effective approaches to preparing autistic youth for meaningful opportunities in adulthood? You got to hear from Andrew and Luis, who are both adults, about what their lives look like and how they are engaging in the workforce and in different ways. So, how did they get there? How do we understand that? And that community participatory research that Stephen Shore talked to us about, it's vital. That's the only way we're going to get to many of these answers is understanding the autistic experience and better understanding how do we build systems of support that are designed with and for autistic people. So these are just some ways to kind of conceptualize different real world priorities. And then I'm going to show you some headlines that I wish were written about the world that we currently live in. And so I'll talk to you about that here in just a minute. But these priorities are huge. So physical health, we know that people on the spectrum have more issues with healthy weight, maintaining healthy weight. We know that cardiovascular health is a risk for them. We know that there are new understandings about the association between Parkinson's and Alzheimer's and autism. We know just there's so many things that we have to still learn about what autism and these other co-occurring conditions look like and how do we support people on the spectrum to be healthy and to thrive. So certainly I would say it's important to recognize, and I know that we've touched on a lot of things in the last 50 minutes, which I know I'm a little over, is that we have a lot to balance. We have a lot of competing perspectives. And I would like to say that I wished we could get to a place where they're not competing. As a pediatrician who serves literally the entire spectrum from age 12 months to my oldest patient's now 32, because I keep getting older, darn it. And so then they keep getting older as well. But I can tell you, I sit with people with very high support needs and love getting to understand them and think about what their needs are. And I sit and work with people who have very considered lower support needs who also are struggling with depression or finding a job or different things like that. So competing priorities about who needs what, when, and where, and how, probably not the best approach. And so I think it's important for us to listen to each other and maybe engage in more civil discourse as we think about these tough discussions. And then certainly compassionately navigating with autistic people and their families along this journey. I think that's important too. You can hear splashy news headlines about the latest and greatest diagnostic aid or the coolest thing that just happened in this space or biomarkers or things like that, all meaningful. But what happens after that diagnosis? That diagnosis, one moment in time. What happens after that? Who's going to be along for the ride to support that person and their family as we go? Obviously, I'm pretty passionate about supporting professionals. We need more people to be informed and equipped players. That means anybody with profession who's part of their profession or just frankly part of their citizenry to be able to understand what autism looks like and the need of autistic people. Okay, so imagine now that we get a chance to write these headlines. So you can, doesn't matter, right? Like we can play around with our own headlines. So think about what it would look like if we got to write our own headlines. And what would it look like if we anchored ourselves in this thriving across the autism spectrum? It's a big spectrum. It's amazing. You got to hear some cool stuff today during our Listen to the Spectrum. I get to hear it every day. I bet many of you do as well. It's a joy. It's amazing. So what would those headlines look like? I'm just going to read a couple because I know we're over and I do want to get to some of your questions. But certainly, wouldn't it be cool if we woke up to a headline that said all U.S. pediatric residencies include competency and skill-based autism best practices as like a requirement for graduation? Oh my gosh, that would be so awesome. But the fact of the matter is that only 4 weeks are spent in any current pediatric residency on development. That's not enough. That is not enough. And so imagine if we wrote the headlines and that we were writing headlines to help design how a system could work for autistic thriving. And so certainly when we think about this, I would also include things like, wouldn't it be cool if we woke up to a headline about regional YMCAs banding together to offer water safety classes for autistic children and youth? Or maybe what would it look like if the National Association for Police Organizations implemented universal training on understanding autism and disabilities so that the next time an autistic person who's living in an inclusive community for people with disabilities calls saying that they are suicidal, they don't get shot and killed, right? So imagine what that could look like. Now, I know that these are big, lofty headlines, but what could it look like if they were real? And what would it take to have us being working together to achieve some of these goals that would allow autistic people to thrive in community with all of us? I think that's an important piece for us to think about. I'm going to wrap us up and head into some Q&A time, but I do want to remind you that it takes all of us being empowered and informed to become local experts. And so when we think about this, we think about all of these different spaces, not just here in the US, not just here in healthcare or wherever, profession you're coming at this from, but certainly we all have a piece to improving the opportunities for autistic people and their loved ones. So I'm going to stop there and I'll stop unsharing or stop sharing my screen. And then I also get to look at your amazing questions, and we will engage with some of those Q&A. Thank you for humoring me to go a little tiny bit over. Isn't it ironic that all the other speakers did a great job of conforming to the rules, and yet I struggled? Sorry. All right, so let's dig into a couple of these great questions. All right, so let's see. Okay, let's see. Okay, so I'm gonna hit. I know there have been some good questions that I've seen come throughout the day about ABA and kind of the controversy associated with ABA. So when we think about ABA, here's the thing, and I'm gonna again, right this minute, I'm speaking from my perspective with my hat on as a pediatrician. I think that we have to realize that there's a balance that we need to understand about ABA. There are definitely people on the autism spectrum, children, young children, who are learning a lot of skills through the science of applied behavioral analysis. I get it. I'm well aware of the controversy associated with more demand perspectives as far as like forcing kids to comply. So compliance-based therapies, I'm not a fan of that. I spend a lot of time talking to families about how do they know if ABA is going to be right for them? How do they know? How do I know? What are the things that I think we need to be looking for and monitoring? How do we identify appropriate ABA organizations to support a young child? But I think this is an important thing. We can't just take a headline or even, frankly, a commonly held belief among some in the autism community that ABA is bad. I think that kind of all or nothing thinking gets us into a lot of challenges. There are some incredibly meaningful, powerful, and frankly, not negotiable things that have benefits that have come out of ABA for many people who are on the autism spectrum. That does not diminish the trauma and the experiences that many autistic people, especially who experienced ABA therapy in the early 80s and 90s, have shared and helped us to understand. So the question that came from the audience is about ABA has a horrible rep in the autism community. I get it. I'm aware. Does the healthcare community not share that same negative view, past or present, of ABA? And why do we think that there's a difference? So I'm going to dig a little deeper into that answer because I think also, like everyone, clinicians also buy the headline and don't necessarily understand all the details. And so I think for a long time, and also still to this day, pediatricians, again, given all of the things that they have to kind of cover in their walks of profession, they kind of also, recognized or kind of bought the line that autism equals ABA. That's just not true. So when you have a person who's on the autism spectrum, when they need help with skill development in specific ways, that's when ABA is appropriate. When you have an autistic person who may have significant interfering or maladaptive, as some people describe it, behaviors, and you've already ruled out all of the other things, that may be another situation where ABA may be a right fit for that particular child. But here, all of the variation that I'm adding, right? That means there's a lot of understanding that had to go into that to know how to support a person in making that decision, in this case, for a younger child about ABA. So no, I don't think healthcare is blind to the controversy, but I think what we're trying to do is become more aware of the ways that we can use ABA when appropriate, and how do we know when one is an appropriate opportunity versus other options when it may not be. Okay. So lots and lots of questions. Let me just look at a couple here. So I'm going to answer one that I think comes up quite a bit too, which is about how do we help parents navigate or caregivers navigate who do not want an autism diagnosis on their child's medical records due to concerns related to some of the data registry issues that have come up. That was a headline I chose not to go into, but I think it's an important headline. I got a lot of phone calls at my office following the headline about the kind of national registry related to autism. I haven't heard really any since about the week around that, so that's good news. But again, I think that's where we have to realize that those headlines are scary. That's what people are hearing. Oh my gosh, we're going to put every person in the United States who has an autism diagnosis in our registry. Well, what does that mean? Right? And so it turns out it doesn't really mean a whole lot, except at the same time, do we all have a lot of information about it? No, not really. So what I did when I was experiencing that with a lot of families in those initial days after that announcement, just talk it through with families about what do we know, how do we protect data, what's the role of my job as a physician to protect data, and what's their role as a parent in relationship to that data. I think that was an important conversation that continues to be had, but again in very much less frequency than as it was right at the announcement of that. So certainly lots of things to kind of unpack there, but I can assure you that that was a huge worry for many, many people. And again, that seems unfair that families have to question how their data was going to be used in that context. Okay, so I'm going to take another one or two questions. Okay, so one question is, what would be a great way to influence our legislators not to cut money from inclusive initiatives? Love that. First of all, I think that a lot of our legislators, don't have a lot of understanding about inclusive initiatives. So I think the more we can do to demonstrate the value of inclusivity, inclusive initiatives, inclusive employment, all of the different things that we've talked about, in my opinion, that's what really matters. How do you do that? That means you've got to make relationships with your lawmakers. I know sometimes people are like, no way. But it matters. It matters. Even if you don't see eye to eye with them on certain topics or even on most topics, it still matters to have your voice, your experience, your lived experience in many situations out there saying, hey, this makes a difference. For those of you who are with us this morning and Winnie was talking about those inclusive classrooms, those stories matter. Now, here's the thing. Sometimes when you're talking to decision makers like legislators, you have to help them understand why it should matter to them, right? Well, outcomes matter, meaningful employment matters. Different things like that are really important often to decision makers. But still, first step is making sure that they are aware of the things that are going on in your community, helping educate them about the importance of including different ways of thinking in the their communities and their societies. Because here's the deal. Many of you on here, this is not the first time you've heard about neurodiversity. It's not the first time you've heard about neuroaffirming practices. But guess what? There's a whole other large percentage of the population who's never heard about those things. We have to do a better job of teaching, empowering, equipping, sharing this important information so that people can have access to what they want to do. Okay. All right, so when we think about the last question that I'm going to talk through is what's my opinion on cognitive behavior therapy for an adult on the spectrum? I think it's amazing. One of the important things that I was thinking about in relationship to Charlotte and what she shared, you have to understand that I have been seeing Charlotte, the young gal, the eighth grader on the spectrum since she was 2. And so I've known her for a really long time. And so hearing her say that the thing that's made the biggest impact for her is her therapist, who's employing many cognitive behavioral strategies as well as a few other modalities. That was so awesome. You got to hear directly from her. So I think that's the best answer I can share with you. It works. What we know is that when therapists are able to feel empowered to modify the approaches that they already know so well to be used with autistic people, that's when we see the benefit coming from cognitive behavioral therapy in the autism space, adult or child. So I think it's important for us to understand that. I also want to dispel a common myth, which is that if the person that you're thinking about mental health therapy with is minimally speaking, that they can't benefit. That's actually also not true. There are different ways that can be employed, used to try to work with a person who has different communication strategies. Really important for us to challenge our biases. I think it's easy for us to say, oh, they can't speak, therefore there's no way they can engage in this type of therapy, or they can only speak in short sentences, whatever. That's just not the case. And that's not what the data tells us. That's not what the evidence shows us. So certainly important for us to think about how do we how do we challenge those long held beliefs for some, or newly minted beliefs for others? Because I think it's really important for us to think about. All right, last question I'm going to take, and I might kick myself for taking this one as my last one, but I will because I think it's important. How do you respond to parents who are adamant that vaccinations cause autism? Great question, right? This is like the money shot question, and I wish I had an answer for, but I do not. Now I have an answer for how to work with parents and how to help them understand the role of vaccines and the public health benefits of vaccines. But I also get it. So here's the situation. We're in a situation where I, as a physician, and if you're in the diagnostic space, I don't have a lot of answers, right? Like I don't have a lot of things that I can say, oh, yes, I'm going to make this diagnosis for your son or daughter, and here's their strengths, and here are the things we need to work on. I can do that, but I can't give them a lot of answers as to, and here's what we know. This gene caused it, that thing did it, whatever, right? It's just that's not in the cards. And I would say it's not in the cards because this is a continuum of the neurodiverse experience. That means that all of us are somewhere on that continuum. So I don't like talking about causes. And in fact, I think it's frankly a little bit frustrating to hear when people, not you all who are asking questions about that, but it's hard, right? I'm like, I love this human that's in front of me, autistic or not. I get it. Some people have very intense needs, and being able to alleviate some of the distress that those needs cause would be really powerful. However, I don't think labeling something as the cause is really beneficial to anyone. So I like to help parents think about, all right, let's look at the data. I'm very big fan of talking about what do we know and what do we not know. So I often in these situations with families will walk through like what does the science tell us about vaccines and what does the science not tell us about vaccines. I think those are two important sides of the same coin. I think a lot of people will stop at the here's what we know, it doesn't cause it, right? And yes, that is also as a card-carrying pediatrician, my also informed opinion is that vaccines are not linked to autism. But I'm also not going to spend hours and hours and hours trying to convince somebody that that is something that they strongly believe. I'm going to help them understand what I know and what I don't know and figure out what we're going to do next to move that child and their family forward. So I think that's an important piece. Of course, I could talk about that too for like an hour and a half. But the bottom line is, I don't think it makes sense to just argue about stuff. I think it makes sense to meet people where they're at. And if they're at that space of acceptance, understanding, whatever you want to talk about that relates to kind of causation and finding a way to make things better, meet them there and then work with them as they learn more, as they engage more, and kind of go from there. I think it's also really important that we remain humble. I think we don't know everything about all the things and autism. I said that before, right? We are constantly learning. And so, sure, I'd love to sit here and tell you, like, absolutely, emphatically, no way, Jose, do vaccines, or is there a link between vaccines and autism? I don't think that there is. And when I look at the data, I don't see a link. There may be some associations that people like to highlight, but frankly, that's also very few and far between. But I think we have to still remain humble because there's a lot of things we still have yet to learn about everything as it relates to autism.